start, I would just really like to ask you, and just in case anybody else is coming through, is, is there any particular challenges that you're having right now? Is there anything that you particularly want to get out of today's session that you think you've come on here and you're thinking, you know what, I want to have achieved this by the end of this hour, this very valuable hour of yours? I'll open that up to the floor.
I just think it's a matter of, when you've got to have that conversation, is eating the frog and getting on with it. But it's difficult, isn't it? Or do it later, or do it tomorrow, and then it gets worse.
Yeah.
So.
Absolutely. Anyone else like to add anything to that? Because we all have these conversations, don't we? Anybody new to leadership on this call? Who's never had to have a critical conversation? Right, well, I am going to start sharing my screen. Don't know what happened there. I disappeared. I'm going to start sharing my screen again now. Can everybody see that screen? I know I've not got it on. Everybody see that? Yeah. Okay, brilliant. Okay, so obviously today is how to have effective, confident and critical conversations. So in terms of introduction, and it was really just to find out from you if there is anything that you wanted me to cover today, then I'm very happy to bespoke it to you. This is something that we do, it does form part of our high performance leadership program. It is something that we are very passionate about, but I'm going to cover a few bases throughout this, and it's more that, it's really what you need to do prior to this conversation. What would prevent you from having this conversation, then talk about what happens during the conversation, and then what happens after the conversation. Okay, so that's the basis of this. So in terms of why do we struggle as humans, it's generally because most of us, especially in health and social care, it is because we care, and that's why it is such a difficult thing it feels like a difficult thing to do. And most humans, as much as however awful the news is at the moment, most humans don't like conflict, and we avoid conflict because it doesn't sit right with us, and that's human nature. And then the last one is really thinking about, we talk about there's a lot of things talking about difficult conversations, and I think just reframe it is the most important thing, because it isn't difficult, it's critical. And it's critical because if things don't happen and things don't change, then it just makes it so much easier to think that it's a conversation I have to have. It's not going to be a difficult conversation, but it is critical to you and it's critical to the business. So definitely think about that reframing. So I did run a session a week or so ago, and that was on running a values-based business. And values are, if you were thinking about why is this conversation happening, and if you think about, if you have values that are fully embedded within the business, then it actually prevents these critical conversations from happening. And I'll just recap on that, if I may. So if you've got a your values-based approach, and you have values that are completely embedded within the business. So you can see here, this is a values-based chart structure. So on one side, you've got characteristics that are warmth. So that's really how you actually build trust, and trust is absolutely integral, because if people don't trust you when you're having this critical conversation, then they don't engage with you. So trust is really key. And also then they need to respect what you do, because of, you're the manager, they need to think that they certainly need to understand that you are coming at this from a place of competence as well. So this values-based is so important. So you think something like, if you have integrity as a value within your business, then that generally means that you do the right thing. This is whether your line manager is there or not, everybody does the right thing. You know that you can leave your team at any time and they will do the right thing. But you've got to have that value embedded within your business for that to happen. Some people just do the right thing naturally, and we know that there are people out there that do that. Most people do, but it's just making sure that that is a reality for your business. And then on the competence and respect, if you've got a value like professionalism as part of your value, then again, it's having that from a competence perspective, is that you are a professional organisation and you expect professionalism when people turn up to work on a day-to-day basis. So just those two values can make a huge difference, and you can choose whatever values you want. It has to be something, perhaps you already have values already embedded within the business, or you think that you've got values, you know that there is a set of values. Well, are they fully embedded, and how have you fully embedded them? Because this is about making sure that they're running through your one-to-ones, making sure that there's part of the recruitment process, as part of the retention process, as part of supervision. So they have to be completely fully embedded as part of it. And if you have that, it makes any critical conversation that you come to have in the future much easier. Now, this is good old Maslow's hierarchy of needs. And again, is that people need to trust you. And again, we talk about this on our high performance leadership team training. Trust is absolutely essential for people to feel psychologically safe within your business. And if you look at Maslow as a very basic form of what people want from a business, from an organization, it's really thinking, well, okay, well, if this is physiological needs that they require, that's their need, then making sure that you do have a strong ethos to support the well-being. If it's safety, safety is really important to them. Well, are you ensuring that employees are safe through quality assurance processes, through using the latest technology? Most people actually want to belong to something. So how do you create that sense of belonging within your work, within your work environment? Then also personal development, really critical. So what are you doing in terms of career pathways? And then finally, self-actualization. If it's not set in stone within your business that you want every employee to love coming to work every day and to be that employer of choice, then it's thinking that's aspirational, isn't it? That's what you want people to achieve. And I would love to hear from anybody if you think that you've got this embedded within your business and the results that it's had. I would love to hear from you. So again, if you have those values based and you have the Maslow's hierarchy of needs, it does limit the amount of critical conversations that you have. So it's sort of prevention rather than having to go through that process. However, there are some times when you've got all of that, but you're still going to come across those people that unfortunately, for one reason or another, you know, they're not getting it, and you need to be able to manage those effectively. And this is something from the book called Necessary Endings, and I will talk about that in a little bit more detail. So it's Dr. Henry Cloud, and he talks about really thinking about who people are, and he's categorized it into these three categories of the wise, the foolish, and the evil. So if I'll take you through those categories. So a wise person mostly, and most of us are wise people, is a wise person if you tell them or you mention to them, you know what, I've noticed that you're doing this at the moment, and I need to know what, it's not sitting very comfortably with me. I'm not sure what's going on. Is there anything going on? Did you know? Were you aware of that? And most wise people will say, do you know what? You're right. I have been feeling a little bit stressed at the moment, so I'm really sorry about that. If I've been short with you, I'm really sorry. So that's the wise person. The foolish person is where you keep having the same conversation with them over and over again, and you keep having the same conversation, and they keep, when you have this conversation, you meet with them again, what happens is they keep making excuses, and they keep saying, well, it's because of Becky in marketing. I haven't done it because she was supposed to deliver this to me. It could be excuse after excuse, but whatever it is, it's not happening. And with a foolish person, what you need to do is to stop having that conversation with them. So you just say, you know what? We've had this conversation, we've had a meeting now, we've had this meeting 3 times, and each time I have said that I want you to have achieved this, and each time you've come to me and you've given me this excuse on this day, this excuse on this day, and now you're telling me today that you still aren't able to do it. So what I'm going to have to do now is actually take that task away from you. Or I'm going to, you have to somehow stop having that conversation with them. Then there's the evil person. So the evil person, and how you know that they're an evil person, and you tend to really get a sense that they are bad people. And you'll know when they're really bad is because when they exit the building, they generally say, and I'm going to take you down with me, as they part. And you know, this is reality. This is not, you know, this is, I know people who've experienced this. So this is what Dr. Henry Cloud says, that you have to, you know, it's gun, lawyers and money. So you have to literally exit them from the business as quickly as possible. It might cost you to exit them from the business, but whatever it is, you need to make sure that they have exited and gone. Because if you keep them within the business, it can be so much more disruptive to the business if you don't actually deal with them. And for me, that's not, I don't have a problem having those conversations. I don't have a problem having a conversation if that particular person does not fit in to the values within the organization, because it's a safety issue. You know, you've got to deal with it. Has anybody got any questions on that? No. Okay. So that is, before you have this conversation, if you've got a critical conversation coming up, think about what is the likely chances of the type of conversation that you're going to have. Are you going to have a wise conversation? Are you going to have a foolish conversation? Or are you going to have an evil conversation? So just think it will allow you to prepare a little bit more once you've done it, because that different people need different strategies. Okay, so now I'm going to go into this. Again, is just sometimes, and this is an employee segmentation tool, so that sort of complements what I've just shown you on the wise, the foolish, and the evil. But and I've got a template that I'm really happy to share with you. So this employee segmentation, you can see you've got the 4 quadrants there. You've got an engagement going up, and then you've got the return on investment going across here. So an A employee, we'll start with the A employee. They're super engaged with you as a business, and you know that you can rely on them. They're in terms of return on investment, that you've employed them and they absolutely maximize that return on investment. So they're super engaged, maximum return on investment. The Bs, they could be, they're really good workers. They're not quite as engaged with you as you'd like. So what you really want to do with those Bs is try and move them to As. That's the whole point, is trying to get them super engaged. What's their sweet spot? What do they want from you? And you talk about Maslow's hierarchy of needs, just thinking about, okay, well, what would that look like for them? Where are they within the Maslow's hierarchy of needs? Perhaps they want more social engagement, perhaps they want the personal development, but just find that sweet spot for them. The Cs are, they like what you do, but they're doing it on their terms. So I would classify these as bank staff, perhaps. These are the people that are fitting in with their lifestyle. They're good for the business because they actually, they fill the slots that you need them to. But and there might be a chance, perhaps they can only work in a certain amount of hours. They can't give you the shifts that you'd like them to do because of family commitments. So it's worth their fine. It's just been recognizing that, they're not the priority sometimes because you want to do more for the A's and perhaps the B's. The D's are low engagement and the return on investment is minimal. These are the ones that cause you the grief, the ones that let you down, the ones that, that they just seem like hard work. They could be the ones that spread gossip, they're disengaged, they're causing much more trouble than they're worth. And with those Ds, and I would, as I say, I've got this template that I can send across. If you've got Ds, you've really got to think about how you manage them out of the business. And that is tough. When it's so hard to recruit people, it is a tough decision sometimes. However, sometimes you have to go backwards to move forwards. Has anybody got any questions on that? Sorry, I can't hear you. Sorry, I couldn't hear you then. Sorry.
You're recording this, aren't you?
Yes.
Yeah.
We can take anything out.
Just relax on my writing. I'm trying to write things down, but I can't relax.
I'll take a break. Has anybody got any questions on what I've been discussing? Does that seem about right? Yeah. I think a lot of companies, they do, certainly in my experience, a lot of people think that they can try and persuade the Ds to act differently and spend a lot of time trying to do that, and it generally doesn't work. So when I go back and Suzanne, hi.
Hi, it'd help if I could turn my mic off. On, I should say, not off. Yeah, I think thinking about over the years, thinking of these people, because I think that we used to, I think the terminology just certainly changed on what we used to call people. And I think toxic used to come into it a lot. And we used to have, I think that as an old terminology of like toxic employees, which we knew that we had an issue with. But you would actually be exhausted because the amount of time you spent with these people, it just went on, and other people weren't getting as much attention because you had dealt with these people for so long, and you went down so many different routes with people. You went down employee improvement plans, disciplinaries, and it is a difficult one, yeah. And it's trying to find the right words and things for this type of person that you're trying to help, or you end up having to, I don't know, you do, hopefully you keep your fingers crossed that they don't come back sometimes, and that sounds terrible, but you just hope one day they'll resign. because but it can be very difficult to deal with these types of people. So yeah.
And absolutely, and it's almost having a process in place within your organization. What do you do when this person first shows up as a D or a toxic person, and you're thinking, you know what, I need to deal with this. I need to either nip this in the bud now, or I need to deal with it now. So you've got the options there of which route you take. But the problem is, if you don't deal with it, it massively impacts the good people, doesn't it? I'm sure you have realised yourselves that, you know, if you don't deal with it, then people say, well, they get away with it. Why don't I get away with it? You know, I can do it if they're doing it. So it's really difficult to if you don't deal with it right there and then and take action. Okay, so I'll crack on with so that's the.
Sorry, Sue, we've got another hand up there.
Oh, sorry.
Bear with. Was it Rachel? Sorry.
Rachel. Sorry, I can't hear you very well.
Can you hear me now? I've got my thing up. Yeah, no, I was just going to say, you know, you talk about, we've all got those people in our organisations, but you know, when you take action, that's the difficult thing, is you begin a process, but then our organisations don't always lend itself to actually managing the situation, and you've I see stuck with these people with this toxic nature, and it does bring the teams down. But I found it really difficult to actually action anything to be able to manage. You know, is there any, you know, route? I mean, it's not disciplinary because it's not really something that they're doing wrong from a clinical perspective in our organisation, but it's just the whole. You know, they're not engaged, they're not productive, they're just negative, they're bringing the teams down, and it's really hard to, any advice on how you kind of manage the actions sort of around that, you know?
And again, this is why values are so important, because if you've and values take an enormous amount of time and effort to embed fully. So we're talking, you know, you've got to repeat it consistently all the time, and it takes a few months to get to that point. But if you've got your supervisions, any one-to-ones that are aligned to your values, do you have that currently?
Yeah, we do. And I'm just thinking of a particular person who just doesn't really care, you know, and isn't aligned with those values, but it just, there's no engagement, there's no motivation to be here, even to the point of saying, I don't really want to be here, but it's just the money for the money. You know, it's very hard to then, you know, do anything with that, really.
That's a really, it's a bad one, because you want people to be engaged, but you've got to keep having those conversations with them, because, you know, and I would be open and honest with that person. I would say, you know what, I would hate to be in a job where I didn't really enjoy working there. Have you thought about looking for something else?
Yeah.
You're clearly not happy here. I would be having those conversations. I'd just say that, you know, I would feel awful. I want to feel passionate about what I do. You know, it must be awful for you to not have that. Have you thought about something else that you'd like to do? You know, it's really encouraging them to think differently, because even perhaps they like that negativity. So even reframing it that they have to be positive about something might change their mindset. But being open and honest about it is really key. I would be having, you know, because there's nothing worse. I have been there, and there is nothing worse than trying to engage people, because they are a detractor, and they will spread that feeling of negativity.
That's right. Yeah. Thank you.
Has anybody else got any questions before I reshare screen? Okay, So this is that's on the necessary endings. So just prior to the conversation, this is what I would be looking at. You know, there is always a reason for a behaviour, and whether that's a nice behaviour or whether it's a negative behaviour, there is always a reason for the behaviour. And it's really thinking about, where are they from their perspective? What is actually going on in their minds? And really, what do you actually know? What have you, you know, whose narrative have you listened to? You know, have you actually really thought about their perspective and how they feel? And have you really understood how they feel about a certain situation? So it's always worth just thinking about this prior to the conversation, so you are aware and making sure that you know what you think that you could be missing within that conversation, because you don't want any surprises during it. And also, what evidence do you have? Make sure that you go into that conversation with as much evidence as possible. It's not hearsay, it's got to be factual, it's got to be actual evidence that you go in with. And then just before you have that conversation, you know it's going to be a tough one. Just take a moment to be calm and just relax and be as composed as possible, especially if you think it's going to be, you know, quite angsty. You know, you've got to take that moment just to really calm yourself, breathing, going through a little bit of mindfulness. I know that sounds easy sometimes to say, but it's so important just to compose yourself and take a moment. So in terms of the structure to follow, again, this is what we use within our high performance leadership program. So if you think, and I'm very happy for anybody on the call to come up with an example that if you would like me to go through an example, but I'll go through the process first. Perhaps you'd like to think about that, and please do let me know if you've got anything that you'd like me to cover. So example or evidence. So it could be that a care coordinator, perhaps, or a supervisor, you've heard some negative comments from the carers in terms of how they have behaved towards them. So this is, you know, you've really got to be very, very careful as to what that evidence looks like. You know, you can't have hearsay, you've got to have actual evidence. And you've got to have an example. You know, if you haven't got the evidence, you've got to have a backup or structure that you can actually go through that situation. And you've got to get them, once you're giving them that example, you've got to make sure that you've checked their understanding as to what that example is. So that's really key. And then once you're given the example, it is really then talk through the effect that particular behaviour had. And that could be either on you, it could have been on the person, but it could be on another colleague, it could have been on a customer, a resident, but talk about the effect. And then what's really critical now, and especially for people who don't like silences, is to make sure that you just let them talk. Just be quiet and let them do the talking. And sometimes if they're a reflector, because we all have different learning styles, if this person actually needs to take a couple of minutes to actually think about what they're going to say, be quiet for a couple of minutes. And that can be really hard. So really, really take time to be comfortable with that silence that inevitably may come. And once they have started to talk, is really listen to what they're saying, making sure that, you go through this, you, me, agree. So really thinking about, who is doing the listening, who is agreeing. Really making notes as you're going through the process, clarify the understanding at the end of it as well. So, this is what I think I've just heard, and then go through what you've heard and then ask them, is that correct? So really clarify that understanding. And then finally, there is the change or continue. So you can use this structure for both positive and negative feedback. And I actually really like it because it's factual. And I don't like the ones where they put, you know, they start with a positive, put a negative in the middle and start with and end with a positive. I think that is somehow contrived, and I don't think it actually builds trust. So it's just something for you to be aware of. That's how I would feel if I had that approach used with me. So that's the approach that I would take. So I'm just going to stop sharing again. Has anybody got any examples that they would like me to go through as far as that is concerned? And you don't have to mention any names, it could be, but if you wanted to talk through that process, has anybody gone through that process? Hi.
Hi, hi, I'm Helena. Yeah, I think I'd been through that, though in a Unix setting, in the sense of it was upwards as opposed to downwards type motion. But essentially we had moved through that cycle, that structure, without necessarily knowing it, in the sense of I think you could feel that tensions were rising. I think it was more a case of it was just a misunderstanding that had happened. But very quickly, I think that felt like it was escalating to the point where, I mean, I had emails in terms of evidence to be able to talk through, but I was very aware that actually I was potentially misunderstanding my peer. They were misunderstanding me, and vice versa. So it's being able to have that kind of that awareness, and how also that I may then come across vice versa. They may come across different to me. So we had that conversation. I think it was very clear of kind of when we went into that conversation of having actually this might feel quite uncomfortable. So if that's the case and you want to have a couple of minutes, please feel free to take that. You know, I kind of will do the same. So you give each other the space, and I think it's building some of that respect that potentially was diminished to begin with. And then, yeah, moving through the kind of structure to be able to say, you have come across with this point, this is then how I feel, so actually let's agree to, you know, what direction are we moving forward in, something that you can both kind of agree on as your direction. And then in terms of the kind of commitment to change, I think from that moment we kind of recapped at the end of the meeting, well, actually these are all the bits that we've covered, we've both agreed that this is how we will then move forward, kind of more of a verbal agreement as opposed to specifically in like an email or something like that. But since then, I think things have been massively, they've improved significantly. But I think it's a testament to the structure that it definitely works. But obviously I'd move through it without knowing it.
Yeah. And I think you make a really good point. And what I loved everything about Helena is that your tone of voice throughout that was very unemotional. It was very as it was, and I think that's so important, because when you're engaging with somebody in that, there is no emotions to it. You've just got to go through a process. That's all it is, and we're all happy. We're all good. We're all adults. However, I know that a lot of, I mean, I am guilty. If somebody calls something, you know, or I react emotionally. So I've had to learn that if I hear something and it strikes a chord emotionally, I've got to say, you know what? I just need to go and take a couple of minutes, as you just said. I need to just go and take a minute. It's just hit me. It's hit me here. So what I need to do is just go and take a moment, have a think, and then I'm going to come back in a few minutes, if that's okay. But all I would say is that absolutely, when you're talking about, you know, within a team meeting, if you've got team meetings, go through this process with them, because it's such a vital skill when they're having to deal with either resident families, customer families, patients. We're all having to deal with this sort of conflict on a regular basis, and the more that you can teach them how to manage those critical conversations in all those shapes and forms, the better. So when you do have your one-to-ones, they actually know how to react towards them which would make it much easier for you, I think. But yes, no, I do. I know it's hard when you get a reaction. Would anybody else like to comment on that? Anybody else? Anybody gone through a similar sort of structure, and how did it work for you? Used a similar structure? No, it's a tough one, but I think you've got to get comfortable with it no matter what. So the next one is really thinking. We just spoke about it before, is really thinking about, you know, how you're presenting yourself, thinking about the environment that this person is coming into. Is it going to be really super formal? Are they going to feel slightly threatened if it is super formal? Can you make it a little less formal? Thinking about your body language, your tone of voice, the words that you choose is absolutely key here. So body language is a huge factor in this, and the words are a very, very small factor in it. So tone of voice absolutely is critical, keeping it calm and keeping it one level. So during the conversations, we've just sort of touched on that, you know, you can't control what happens in these conversations. You just cannot control. You never know how people are going to react, but you can control how you react to them. So if there is, you know, if it's emotional, then yeah, again, you can do exactly what Helena was saying, you know, you can take that time out. Angry reactions are quite difficult, but again, really important that you remain calm. And it's a case of, okay, well, and I would call it out. I would say, you know, I hear how angry you are at the moment, and I understand that you're feeling angry, but what I can't do is continue with this conversation whilst you're feeling angry. So what I'd suggest is that we take this offline now, we give ourselves some time, and we reconvene this. So just end it, because you don't want to be in that situation, and you've got to call that into account right away. If it's denial, that's a difficult one, you know, because you can call the evidence, and again, I would say in the evidence, I would call it out and say, okay, well, you're denying this, but I have evidence to suggest otherwise. So we've got to somehow agree to what's going on here. So we can either do that now, and we can go through the process, and we can perhaps invite people in who've gone, I don't know, that might be possible, it might not be. But let's go back, and we will, or find another time so you can actually get the people in who said that, if you can. So again, denial is a tricky one. But again, absolutely remain calm and try and end the conversation well. You know, whatever it is, whatever the outcome, you've got to try and end it well. So after the conversation, make sure that you follow that up, make sure you record, make sure you monitor the process as part of that as well. So that was it from me as far as the presentation is concerned. Was there anything that you would have liked? Hi, Suzanne.
Hi, can you hear me okay?
Yes.
I was just thinking, actually, I was trying to go through all the scenarios and things, and I have got an example that I can think of to do with a staff member who I actually had gathered data. I don't know if, I'm not going to name names or anything, but to give you the scenario, I actually found a staff member in a resident's bedroom using their mobile phone, whilst a resident was actually using the bathroom in the same room. So it was obvious, I had factual evidence, I witnessed it. I had to speak to the staff member and say and explain about the effect and confidential and reasons why she shouldn't have her phone, etc. like that. Gave her time to say, well, I was on the phone to my, I think she said it was her doctor or something, I was like, well, that's unacceptable as well. But actually, it turned out at the end of the day, even when I said, you know, you and I did record it, I formally recorded it. You know, this is a conversation we're having. I'm noting this down, but actually, she made a complaint about me. So that was the difficult part, because I felt that I handled it at the time. But I don't know if anybody else has experienced that, because this person was very feisty and very confrontational, and I knew that it would be a difficult conversation, but I didn't know it would be taken in that kind of context, that the complaint would be made against me regarding how I'd handled it. But I don't know if anybody else has experienced that sometimes it's we know we've got to have the conversation, but it kind of like you thought, oh, what's going to happen from this conversation? But that certainly affected me.
Yeah.
Yeah.
I don't know, Helena.
I personally haven't, but I do know somebody else who was in a very similar situation, by the sounds of it, to yourself, Suzanne, in the sense they tried to manage, I think, going back to the type of people, I think what would be categorized as I suppose, the evil category. The situation very quickly got out of hand because, unfortunately, HR wasn't there to support. There was a significant lack of support from them, of policies and various different processes that should have been in place. And like you say, although the lady in question had kind of gone through she'd put together her evidence to be able to say, well, this is, you know, as an employee, this is what my issues are, let's try and work together to correct. Ultimately, she'd been put into the same situation as yourself, where, yeah, she'd been hit with a what's it called? I can't remember the word. It begins in D, one of those HR terms. But yeah, she'd been put in a complaint against her, and that then significantly did impact the employee, in the sense of she felt like she didn't want to come to work, all that kind of stuff. And again, it's how you manage some of these conversations when you don't necessarily have the support from HR, because I think you can move through a lot of these structures, but without that support and the backing that you'd get from HR, from the people who are there to support you, it can be very, very hard to manage some of those people out of a business.
Yeah, absolutely. And you know, that's critical. You've got to have that you've got to have, and again, I go back to the values. If you've got, I mean, I just don't know about the Suzanne, but that, for me, I would be saying, you know, for that person, why, and you might have done that. I'm just thinking, you know, what was going through their mind when they were having that when they picked up the phone of that resident, what was going on in your mind when you did that? You know, is because that's clearly against the values that are in our organization. You know, I don't know, but you know what I mean? It's that, what was going, because that is, you know, when you're talking about integrity, that's not integrity, is it? You know, that's not professionalism. It sits outside of what's normal. And the fact that I don't know, but I sense that you perhaps didn't feel as supported as you should have felt when that person.
Yeah. I didn't feel backed up by my management team. No, I felt that they went on. I don't know. I felt that it wasn't a case that they agreed. They knew she admitted that she was wrong, but they didn't. The support wasn't there that I expected it to be there, to say, you know, these are the things that we're going to do. And I just felt that, I don't know, it's like, should have turned a blind eye? No.
Yeah.
But I wouldn't have done that. No.
And that is exactly what we don't want to happen, isn't it? You know, managers need to feel supported in what they do, 100%, and I would be really upset about that. So I'm not surprised you're both upset. Denise, did you say?
Yeah, I was just going to say, I suppose you can look at it the other side. Did you say that she was calling the doctor? You know, is there something going on in her life that?
It was her doctor, yes.
Yeah.
so
yes. You know, I'd like to think that somebody could come to me and say, I need to speak to the doctor, you know, to be transparent about it all, and you know, I know it's private and confidential, but why was she cornered into that way of using somebody's phone? And you know, I wanted to feel like they could come to me and say, I've got a problem, I need to speak to the doctor, you know. It was their
own mobile phone.
Oh, it was her phone. Oh, sorry.
Yeah, and she was actually sitting outside the person's ensuite bathroom on the phone while the resident was on the toilet.
Yeah.
So completely inappropriate.
Yes, yeah.
But she actually blew up, and she actually stormed out of the office after I spoke to her and left the building.
Yeah.
So
yeah, you're the type of person, if she'd have said, I need to speak to my doctor today at a certain time, you know.
Yes, you would have accommodated
it. Yeah, yes. That's right.
So, or I'm expecting a phone call from, because sometimes they call you back, don't they? I'm expecting a phone call. I'm going to have to take it because I've been waiting. You know, all of these things, it's just preempting it. But for me, it's like there's something fundamentally wrong with somebody with that mindset.
Just a very difficult person to manage, let's put it that way. It was not an easy. She's not. She doesn't work for us anymore. This was a while ago, and I mean, she was just a very difficult person to manage, is what I would say, and difficult for the team to manage as well. Yes.
Yeah. So, do you have values that does your business, the owners of the business? I take it you're not the owner of the business. No.
I've worked for the company for 30 years, so it's
right.
And the capacity and things. So no, and our values are very clear as a care home industry. You know, as a care home business, they are very clear, and it's very much where we put our residents. You know, and our values, and they're all noted down. There's a staff handbook. There's policies and procedures. It's very clear from the beginning, but I don't know, there is difficult people out there which you have to manage, and it's just how you manage them. But sometimes the lack of support, and you think, I wonder if do they feel that people then have a right to complain? Do employers feel that the insurance company wouldn't back them up? I mean, I've had that on several occasions where the insurance companies wouldn't back up a decision made on something because they didn't want the fallout to then be that the person would make a complaint and then have a case. And I've seen it over the last 30 years they're working in care. It's changed completely. So yes.
And this is why making sure that you're recording everything is part of the process, because you've got to protect yourself, because people do. They do. But again, managing those toxic people, the disruptors within the organisation, out of the business as quickly as possible. As soon as you spot them, it's, oh no, you're not staying. And I think that's really hard, isn't it? In this climate where recruitment is tough, it's actually really hard to manage that. Has anybody got any other questions or anything they'd like to go through?
I suppose another observation I've got is that sometimes I think we work with difficult people, but actually they're quite good at their job a lot of the time. And it's about how to, investing in those people to try and keep them on track with their job, but also raise issues with them when issues need to be raised. Perhaps it might be, like a performance issue, but without them sort of having a meltdown about that and just sort of totally retreating into, just sort of making complaints about you, or, sort of, I think another thing is that people like that can often do is they can be quite damaging with the rest of the team. So, can have a really sort of negative influence on the team. So I think that's something I struggle with, that sort of having that difficult conversation, but it's not with a view to managing the person out of the service. It's actually with a view to keeping the best of what they can offer, because they have got a lot of really good qualities. but just a difficult personality.
Yeah,
Does that make sense?
But then it's like, well, if they're not aligned to the,
it's got to be
being
worth the
compassionate,
investment.
or
Yeah.
or
Yeah.
it's a really tough one, because, as I say, most people don't go to work to do a bad job.
No.
Most people actually think they do a good job. They don't go to work thinking, do you know what, I'm going to turn up today and I'm going to be rubbish at my job. That's not how people think, is it? Even the ones who aren't particularly great, they don't go to work thinking like that. They actually go to work thinking that they're going to do a good job.
Yeah.
It's setting that expectations, isn't it? And what are the cliques within the organization? Who are your influencers within the organization? Who are the really good ones? How could you get them to promote the good behavior within the business? If they get promotion above other people, is that a way forward? There's lots of routes you can take, but you've got to be really consistent in the message, haven't you, as to what you look. This is the direction of travel we're going in. You either come with us or you don't. It's that difficult conversation that you've got to have. Has anybody got any more questions? I did notice a comment in the chat, Becky, on I know you put a comment in the chat about recording. Hi, Becky.
Yeah, sorry, I'm full of cold, so that's why I put it in the chat, because I didn't want to sort of like cough over everybody. Yeah, I've had quite a few different experiences with from the beginning. Sorry, I did join late. I was in a meeting. So one of my areas, from what you were saying before, they used to have loads of gossip and stuff. So I dealt with that bit like in a group meeting, but sort of like had it recorded. But anything we do with staff now, because we've had some quite difficult staff over the last couple of years, that I've sort of like sent put it myself in as a grievance after we've done the meeting. We record everything now. We didn't used to. We used to only record like as meetings of concern, as disciplinary meetings, but we literally record everything. And any troubled or staff that need that nurture, that sort of like extra support, we have monthly supervisions and observations with them now, and sort of like welfare meetings to make sure they're okay. I know everybody probably has that member of staff as well that you think, yeah, they're not our values and stuff. We still do the same with them, because it can either go one way where they get sick of coming in, or they do actually change, because we've had that before where they have sort of like come over to our side. Yeah. So it can work both ways. You can sort of like give them that bit of rope, or they do change. So we've had it over quite tough over the last 2 years with staff, so I've got quite a bit of experience now with making sure everything's recorded. But yeah, I didn't want to cough up, Mike. That's what I put in the chat.
That sounds amazing. And again, I think it's. I mean, I know when I used to work at Home Instead, they recorded every single call that it didn't matter. So every single call was recorded.
Yeah.
And if I had a conversation with a business owner and they weren't happy with the conversation, they could listen to it. Now, I was very happy. It seemed a little bit weird at first, but I was very happy with that, because it actually protects you as a person. It
definitely does. Yeah, it definitely does. We have all those calls recorded, but as we're not all innocent, and I've actually listened back to a couple of calls before and reflected and thought, wow, Becky, you must have been having a really bad day. And I've then sort of like phoned the person and apologized, going, I'm so sorry, because we all have bad days, don't we? But all his calls recorded, and I've got my little dictaphone that I take in every meeting now with me, just to protect myself as well, because you'll always have that member of staff who will think, do you know what, I'm going to put a grievance in because I didn't like the way she spoke to me. But we have to be tough as managers. We have to be tough, or you're just gonna, as awful as it is, you're gonna have staff walking all over you. An example, I sent what we our hours of work are every week for the past 6 weeks, because I get people phoning saying, well, I've booked an appointment at this time. Well, it's your hours of work. And again today, oh well, I can't work after 2:05. So it's like, well, do you know what, you can come in for a meeting, we'll discuss it and we'll get it recorded. That's my backup I need. Because there's just no point doing it everything over the phone, because it's you know, get away with everything then. But to be fair, I'm saying all this, but we have an amazing team. There's only the odd one.
Sounds like you work very hard at that.
Yeah, we do have an amazing team. But yeah, so I totally understand where everybody's coming from, and it isn't nice when you get a grievance in, because you literally question yourself, even though you know you did everything correct. You question your own sort of like actions that you've done, and it does put a bit of a downer on you for a little bit until it's proven otherwise. But a lot of the staff are just sort of like the defensive, aren't they, from when they've done something wrong themselves, and they're taking it out on a certain, you know, individual. So yeah, I totally get where everybody's coming from, because yeah, we've had it hard for a couple of years with stuff like that. So
I know. Well, you've done a great job.
Thank you.
So anybody got any final questions before we close the session? Hopefully you've found that useful. Well, it's been lovely to have you all. Hopefully I'll see you on another how-to session in the not too distant future.
Thank you.
Okay, thank you.
Thank you.